Cancer awareness is the key to early detection and higher survival rates. In countries where health systems are strong, survival rates of many types of cancers are improving thanks to accessible early detection. But in developing countries such as Nigeria, awareness is poor among the general population, which leads to late diagnosis and a high rate of mortality from cancer. While an international organization is trying to change that, led by Dr. Denise Ejoh, the Cormode Cancer Foundation is spearheading the awareness drive in Nigeria, using experienced medical professionals as well as survivors to push a longer-term advocacy and awareness campaign around the country. As a cancer survivor still on active treatment herself, Dr. Ejoh is hoping to inspire Nigerians to seek out health care early and to understand that cancer doesn't always have to be a death sentence. And I'm glad to say Dr. Denise Ejoh joins me now from London to take a look at the World Cancer Day 2022. And so good to see you.
Thank you.
Okay. A lot of Nigerians and people across the world are marking the World Cancer Day 2022. And the focus on how is more on how we could actually improve care for survivors and those going through it. What do you make of this day, and why is it important to create more awareness on this ailment?
Thank you very much, and good afternoon to your viewers. Cancer awareness is very key to making a difference. And this year, it's to close the care gap. So if you understand that there are multiple areas that influence the care of a cancer patient. It's not just about having cancer. There are lots of things that have to be done to make a difference and support a cancer patient to be able to get through. Navigating your way through the journey is very difficult. And this year, the global view is to try and find a way to close the gap and make a difference for everybody in one way or the other.
And a lot of people want to know why it's important for early diagnosis, considering that many people, especially in the developing world, don't think that diagnosis is so important because it could a little bit more expensive and a lot of people don't have health insurance. So how would you encourage people who are actually trying to make daily survival rates for themselves think of going for early diagnosis?
Okay, let me answer this from a perspective of myself. I was diagnosed with cancer in 2016, and I had a headache. So let's go back to the basics. I had a headache. We all tend to have headaches. We don't think very much about a headache. I kept going around and saying I saw quite a lot of doctors in Nigeria because I was working in Minna at the time. And I asked for doctors in Abuja, in Lagos, 3 different hospitals. But I had a headache. And no matter what you say, somebody's saying to you, I have a headache. You just think, take paracetamol. But actually, it was a tumor growing in my brain. And then by the time one doctor just said to me, look, we don't really see anything, so let's just do an MRI. And on opening up to do from their scans, they saw 3 tumors in my brain. Now, medically, I understand that once you have more than 1 tumor in your brain, it automatically means it is cancer. If you have a tumor, it can be benign, but multiples tend to be cancers. And that was where the journey started from. So for me, I have now come to realize that if we do know if we take things a bit more seriously, we may be able to be more alert. So just having a headache, because I won't say luckily, but having the experience of having a family member who had died of cancer, I understood immediately that there could be something wrong. So one advice I will say to anybody, if you have a persistent ailment, that means persistent. I'm saying even if it's diarrhea and it just keeps coming, the first thing to be looking at is getting yourself checked, because it's the basic. Cancer, to me now, from my understanding, is the basics. It's just everyday illnesses that have gone wrong. This is a layman's perspective. I'm not coming from a medical perspective because the doctors have a different understanding of all the things that have started to go wrong in your body. And so for me, it is important that we all get engaged in the discussion. Start from the little things. We say it's not my portion. We don't take it seriously. We go around religion, faith and religion, faith and cancer. You have to recognize it's not separate. Don't leave one for the other. Take both of them and work with them, and you may have a better diagnostics.
And there's always been this focus more on breast cancer awareness in Nigeria, and it tends to sort of want to look like it's excluding men from this. So sometimes, some men actually think that it's something more for the women and all of that. How do you think we could actually have more cancer awareness that's genderless, something that is more acceptable to everyone, so that men do not think it's something more that has to do with breast and all of that? Though I've read that even men seem to have breast cancer, though very little breast cancer compared to that of women.
Yeah, that's a good one. If you look at it from the perspective of cancer awareness, so Cormode Cancer Foundation, although I was diagnosed with breast cancer metastasizing in the brain, which means stage 4 cancer, which means it has moved from breast to the brain. And that's where they have a word they call it, where you can see that there's something going wrong. Although I have had to go through that, my biggest campaign today is it doesn't matter what cancer. So we celebrate every single cancer. We have a Zoom session where we talk about the cancer of that month. Because if we say it's just about breast cancer, then what of cervical cancer? What of prostate cancer? But there are also challenges with the awareness of cancer in all of these spaces, because when you talk about prostate cancer, men won't come out. I am trying to get 2 men to come out now and let's talk about cancer on one of our programs. I can't find, even if they've survived it, they say, no, I can't talk about it. And also men do not want to come out because, for instance, prostate, the information what I've learned over the 2 years, 3 years is that the way the illness comes about, men can be told that they may not be able to be sexually active again. So they don't really want to do that. So there are different things, there are different reasons why people are not engaging. But my appeal to anybody is that if you know, you have a better chance of surviving. But if you don't know, or you hide under not talking about it, then it gets worse. Because once you are diagnosed very early, I understand in stage 1 and 2, you have a chance of total healing. So if you see anything irregular, just address it then. Don't wait for it to get very bad, and then you can't do very much about it.
And you have passed through different stages of this cancer treatment yourself. It has affected you personally, but I've reading so much about you, in the media. I've seen how strong you are, how you've been able to engage in advocacy, how you've been able to have a positive thinking, which has helped you to shape the kind of messages you actually put out to the public too, especially for those who are going through it and for cancer survivors. Can you share your thoughts more on that aspect of positivity?
One of the things I was very quick to know is that we have to recognize that you can either make it or not make it. So you have a choice to decide if you're going to at least try. So one of my biggest campaign points is try to fight. Don't give up. No matter what anybody says, try. For as long as you try, you have a better chance of getting through the illness. From the campaigns we go around doing, we campaign because we're trying to reach out to every Nigerian, irrespective of whatever cancer you have. And our message is very clear. Together we'll fight, together we win. If we don't fight together to cross those lines, we won't win. For me, I had to learn very quickly that the mental health challenge is bad. The physical challenge to your body is very, very strong, because your body goes through chemo, radiation, and radio, that's what they call it. It's you go through, you don't want to eat food, you are not looking good, you don't feel happy with yourself, and yet you've got to deal with it. So being positive, taking an approach of, let me at least try to fight and get across that line. And I can recall when I had the 5 years, which was last year, and the whole year was very, very difficult for me because I really was mentally challenged, as in I couldn't understand whether I would cross that line. And a lot of people didn't realize I wouldn't even talk to anybody. I would go and sit with my counselor in an external place just to be able to talk to her and cry out the facts of how I was feeling if I was going to cross the line. So please, no matter what you're going through in cancer, you will have good days, you will have bad days, but always keep your eye on the ball. If for every single day you live, you've crossed a line, and try and make a positive impact on those around you, because your crying can help somebody else. Your sharing this journey helps somebody else. And the more we talk about it, the more we help other people and reduce our death rates. That's my personal view.
And what will you tell those who keep saying that cancer just seems to be an elite sickness? It's more for people who have, monies to spend and all of that, despite the fact that we are seeing a lot of poorer Nigerians actually being affected by cancer.
The reason why we say it's about money is because honestly, we run after. We want to believe what everybody else says rather than actually believe what our body is saying. And for as long as we're believing what other people are saying, we're never going to address what the issues are. The truth about it is it's not a disease for a rich man or a poor man. I've just said it's headache. I had a headache. A lot of people have cancer of the bowels, diarrhea, constipation. I don't see where any of those illnesses are linked to a rich man. But because we don't know, like I always use this adage, my people perish due to lack of knowledge. If you did know that diarrhea consistently can be a sickness that will kill you, you would most probably do something about it. But because we are not being told that, we're being told to go, a lot of people will go into fasting, spend a lot of time praying, believing there will be a miracle. But there are miracles, but you've got to play your part. Eat healthy. Have good relationships, have a good mindset, talk to people, just live life and hope that you can get something good for yourself, not be negative, because negativity does take you down.
All right, Dr. Ejoh, just hold on there. We'll go on a short break. When we come back, we'll talk about the cost of cancer treatment, not just in Nigeria, but Africa. You're still watching the Arise interview. Plenty more still ahead as we continue our chat with Dr. Denise Ejoh. Still with us. Welcome back to the Arise interview. I'm Sumner Sambo. It's World Cancer Day today, and the theme this year is Closing the Care Gap, which raises awareness about the lack of equity in cancer care. But awareness of the disease in several parts of Africa, including Nigeria, is worryingly low. My guest today, Dr. Denise Ejoh, is the CEO of Cormode Cancer Foundation, an NGO championing cancer awareness across Nigeria. She's also a cancer survivor and is using her story and journey to remove the stigma and fear attached to the disease, as well as help people recognize its early signs and symptoms. And Dr. Denise Ejoh is still with me from London. And I would like to you to shed more light on the average cost of cancer treatment. I mean, I read your story, and I just was like very thankful that you had this sort of support that you could get in treating this. How could one be spending £10,000 on just one treatment and doing that over and over? And here you are looking very strong. How many people can afford such costs? What's the average cost of cancer treatment like?
That's a very interesting one. In different countries, the cost is very is high, and it makes a significant difference. When I look at it, I think that's why I said I think it is best for us to focus on early diagnosis so that we don't have to pay the cost, because I can't tell you that my treatment can be less than, so far as of today, it can't be less than £250,000. It can't. I know that. And it's not, and that is being very economical, because I take chemo every 3 weeks. And I've been taking it for 5 years plus. and I took it yesterday. So it has to be done. And if you check the cost of the chemo, even in Nigeria, luckily there are lots of ways. Some cancer treatments are being provided at subsidized rates in Nigeria, and a lot of NGOs, where we have the NGOs, an organization for a support organization for us. Some of different NGOs actually contribute and help people to access funds, but the cost of cancer treatment is very high. So instead of that, cervical cancer, we're doing the awareness on cervical cancer. So using the cervical cancer, do the test, took the vaccines. It's better to have the vaccines than to have to pay the bills that we're talking about now. It's little things like that I will talk about. Doing the breast checks, it's better to do the breast checks than to actually be in a cancer seat right now. It's better for a man to go and do his PSAs regularly than to find himself sick with the prostate cancer. So I think you're getting where I'm coming from. I am totally driving that let us be aware of what the implications are and work from that point.
Yeah, and I would like to state that at the current exchange rate we have between the naira to the pound, that will cost, that will be about 140 million naira. Only very few persons can actually afford that. But let's talk about cancer treatment centers in Nigeria. Even if you have this money, would you have access to the required treatment, or you just have to go outside the country?
No, I don't agree with you. No, there are quite a few. We have a few cancer centers that provide good services in Nigeria. Nigeria has partnered with a lot of the global health drive also allows Nigeria to access drugs at reduced price, because the cost of cancer treatment globally is high. So I think it's reduced almost everywhere in the world anyway, because of the nature of the needs of people. In the same conversation, the Nigerian government has done, we have the National Cancer Fund. Well, that is currently being looked at very carefully, because there is funding out in the domain for cancer patients to access funds in Nigeria. NGOs actually support Nigerians to access. Some of us partner with international organizations to help us get funding into Nigeria to help cancer patients. And it's not just about one, there's not one single source of getting funding. There are lots of sources, and a lot of different organizations are trying to partner and get access to funding to help the Nigerian community.
Can you just tell us more about the Cormode Cancer Foundation, what you've been doing? I read that you're actually translating some of these messages into the popular languages in Nigeria, and then you've been making use of social media to drive your point. Can you just shed more light on that?
One of the things, like I said, I started the foundation started or took off in the middle of COVID, in the middle of this COVID pandemic. And so to make sure we didn't wait until that, we started it online using a Zoom. Now we have a Zoom meeting every month to talk about the cancer of the month. So last month was cervical cancer. We had a panel, and we always have a doctor or a medic either in any area. So next week we're on a television channel talking with oncology nurses about, to the public, about what those services, the people that deal with those services provide. We talk to decision makers. So like the head of the National Cancer Society has been on one of our programs to talk about what is going on in the space. We have a television program every 2 weeks on AIT, sponsored by them, allowing us to be able to do a campaign, even if it's 15 minutes, just talk about a cancer in every month. It makes a difference, because the more we hear about it, the better it is. We have a YouTube channel where all our videos are, and people can watch them and all our websites are, all our platforms are Cormode Cancer Foundation, one word. And Instagram, on Facebook, and even on our website, a lot of information is on. We are driving it through social media, but the current plan going forward is to and one of our partners is working with us, is to translate all our work in the Nigerian languages. Now, we have tried to do some, but like I said, we're a small foundation, so funding, as we raise funds, we start to develop the material. We've now got material to now put into the Nigerian languages that we will now be able to get out into the communities, because the communities do not necessarily have access to digital platforms. So the radios, the villages, the town hall meetings may be the next point where we go to next. But for now, we want to embed. We need to embed, not just run ahead of ourselves.
As we try to round off this conversation, I want you to talk about generational passage of this message of preventing cancer. How would you, as someone who had lost a parent to cancer, and then you haven't had cancer yourself, try to ensure that the next generation of people, including your own children, have the appropriate message about cancer prevention, and if indeed it happens, what next should be done?
Okay, I would say to you firstly that because cancer, I understand, is genetic, in some of it is genetical, we have to be aware. So some people, a lot of us knew about when one of the actresses, I don't know if it's, I can't remember her name, where she actually removed both her breasts because it was in the genes. Some decisions are drastic but have to be made. Cancer is expected to be 1 in 2. So that means that almost all of us are exposed to getting cancer. And for those reasons alone, it is very important that we focus on what we're doing. For my children and for the next generation, please just do the checks. It's not to do a breast check doesn't cost you any money. To get yourself the vaccines doesn't cost you a lot of money. So instead of waiting to get the disease, do the things that will stop you from getting the disease. For men, they're now reducing the ages where people can actually, young adults can now start getting tested on a lot of cancers. So we should be looking very carefully, educating in schools. I was in the school system, so I would have preferred to see all schools the federal government putting into the curriculum a section where we are teaching about cancer, so that people don't take it for granted. It's real, it's here to stay, and medical science is making a big difference, but we're not there in Nigeria or in the continent of Africa yet. So we've got to work ourselves through it and hopefully cross the line.
What sort of support are you receiving from, both the authorities and even freelance donors here and there to help drive this narrative?
That's a very interesting one. We have different organizations who are mainly focusing, who have agreed and are working with us on our social media, our airtime campaigns. Individuals help us to do the recordings. As like I said, we're a very small organization that is trying to just focus on what we want to achieve. We are partners with BioVenture, we are partners with AIT, we are partners with the National Cancer Center. We're partners with quite a few organizations. And we are trying to build that, but has to be strategically focused on only cancer awareness.
All right.
So not focusing on anything else.
All right. We must thank you so much, Dr. Denise Ejoh, the CEO of Cormode Cancer Foundation. And I would like to let you know that Arise TV is also providing you support here by giving you this airtime to take a critical look at this issue of cancer.